Good morning, good afternoon, good evening. My name is Tori Taylor. I'm one of the technical directors for Data for Impact. Welcome to our knowledge and learning exchange about locally led monitoring, evaluation, research, and learning. Today, we're going to explore the role of local organizations in MERL activities with an initial presentation by USAID and D4I, and then a panel discussion with two local organizations, the African Institute for Development Policy, known as AFIDEP, based in Kenya and Malawi, and New Era in Nepal, along with a USAID representative. This webinar is being presented in English with live French interpretation. Click the interpretation icon at the bottom of your screen and choose if you'd like to hear the original English. Click French if you'd like to hear French. For those using French interpretation, you can also choose to mute the original audio so you don't hear the background. You can also choose to turn captions on to read the spoken audio during the session. To turn captions on, click the icon with two C's at the bottom of the Zoom screen. If you wish to hide the captions later, please select the same icon again and select Hide Subtitle from the menu that appears. Captions are generated with an automatic feature in Zoom, so they might not be 100% accurate, especially in languages other than English. Lastly, we are recording the webinar, and participants will receive an email with the recording. For today's webinar, I'll continue with our introduction, followed by brief presentations on USAID's approach to locally led MERL. Then we'll hear from D4I on work exploring the literature on MERL leadership pathways, followed by presentations from AFIDEP and New Era, and then our panel discussion. Data for Impact, D4I, is funded by USAID. D4I is a consortium led by the University of North Carolina at Chapel Hill in partnership with Palladium, ICF, JSI, and Tulane University. We work to strengthen local capacity to generate and use high-quality health data for strategic decision-making at national, subnational, and community levels. D4I investigates programs' effectiveness, integrates gender into activities, supports adaptive management, and helps learn from evidence. We draw on the technical expertise that exists in each of our partner organizations and an extensive network of local partners in USAID priority countries. Before we move on to the speakers, I just want to highlight our forthcoming webinar series focused on localization in MERL. Join us on June 26th and later in July to continue this important discussion. Now I want to briefly introduce our speakers and panelists for today. Kiran Achara is the Deputy Director of New Era, a research organization based in Nepal, where he leads projects and supports proposal development and office management. He has expertise in data analysis, report writing, and actor coordination, and his primary research focuses on analyzing inequalities in health coverage and health systems research. Christina Granger is a Senior Social Behavior Change Advisor for USAID's Bureau for Global Health in the Office of Maternal and Child Health and Nutrition. She supports behavior-centered programming for the maternal, child, and newborn health teams, and serves as the localization lead for MCHN. Luana Pawendo Kamanga is a MERL expert at the African Institute for Development Policy, where he leads MERL for the Institute and projects. He spent over 10 years designing, implementing, and managing MERL systems and efforts for development programs across sub-Saharan Africa. Barbara Rollins is a Senior Implementation Research Advisor for the Bureau for Global Health, MCHN Office in the Division of Research and Policy. Barbara has extensive experience conducting and managing MERL activities for RMNCH programs. Lastly, our moderator for the panel discussion, who will also briefly present some findings, is Molly Lauria. Molly serves as the D4I activity lead and is a health systems and policy researcher with 15 years of global health experience in implementation, evaluation, and research. My last point for logistics concerns Q&A. Throughout the webinar, feel free to ask questions of our panel using the quick Q&A function in Zoom. But please don't add questions to the chat. They might get lost there. We'll do our best to save time to answer some questions at the end of the webinar. My pleasure now to hand it over to Barbara, who will share some information on USAID's approach to locally led MERL. Thank you.
Thanks, Tori. At USAID, localization is the set of internal reforms actions and behavior changes that the agency is undertaking to ensure our work puts local actors in the lead, strengthens local systems, and is responsive to local communities. To advance localization, USAID is following 4 pillars. First, we're adapting our policies and program practices to foster locally sustained change tied to each country's unique context and conditions. Second, we're shifting power to local actors and ensuring integration of diverse local voices and leadership within each country. Third, we're channeling a larger portion of funding to in-country partners. And then fourth, we're serving as a global advocate and thought leader to catalyze a broader shift to locally led development across the development community. Next slide, please. USAID aims to achieve local leadership in a minimum of 50% of its programming by 2030, so we have an ambitious goal. Specific to MERL, USAID aims for more inclusive and effective MERL leadership, reflecting a commitment to enhance local input. Next slide, please. So what is locally led MERL? This graphic from USAID's fact sheet on locally led development illustrates how USAID thinks about locally led development in terms of less locally led to more locally led as we move left to right. Locally led development of MERL is the process in which local actors, by which we mean communities, networks, organizations, and governments, set their own agendas for research and evaluation, develop MERL solutions, and bring the capacity, leadership, and resources to make those solutions a reality. Next slide, please. As USAID's localization efforts gain momentum, there is a growing need to identify and document different pathways local MERL organizations can follow to assume leadership roles, including becoming prime funding recipients and exercising local programmatic leadership in other ways. Understanding the capacity strengthening efforts that have fostered greater involvement in and leadership of MERL activities by local organizations is also essential. This will help in understanding and capturing programmatic lessons learned, such as facilitators, challenges, and promising practices for supporting continued advancements in locally led MERL. Next slide, please. Now, Molly will present some initial findings about pathways to MERL leadership for local organizations. Next slide, please, and over to you, Molly.
Thank you, Barbara. So I will briefly summarize some key findings relevant to today's discussion from some recent research that we've done, and we compiled a list of local MERL projects funded by USAID, and we also completed a rapid scan of the literature. So first, we compiled a list of country-based MERL projects that were funded by USAID, and that project list focused on MEL platform projects. And what we found was that they were largely led by non-LMIC organizations, so non-local organizations, and many of the projects had a consortium with very few LMIC or local members. This just demonstrates a key missed opportunity for local leadership across the spectrum of locally led development for local organizations in a key MERL activity specific to USAID. So in addition to that list that we compiled, we also conducted a rapid scan, and we found literature gaps on this topic within common global health sources, as it seems that this topic is not explicitly covered in the literature. One key finding that we found was the importance of ongoing learning and MERL skill development for both individuals and across organizations to support leadership trajectories. And this spans from the beginning of one's career and throughout one's duration working for an organization. Another key insight we found was that both organizational strategic planning and then the effective implementation of the plan were noted as useful ways to support targeted organizational growth towards leadership roles. And lastly, given the literature gaps that we found, future work may benefit from looking into resources that focus on social entrepreneurship development, nonprofit management, and growth, as well as organizational science. And now I'm going to hand it over to Luana, who will share some background about the African Institute for Development Policy, known as AFIDEP.
Thank you, Maury. About AFIDEP, we're an Pan-African Research Policy Institute established in 2010 to bridge the gaps between research, policy, and practice. Our vision is an Africa where evidence is used consistently to transform lives. AFIDEP is a non-profit organization registered in Kenya, Malawi, and the US. It is governed by an international board of directors. It has 80 multidisciplinary, multi-cultural staff from 11 countries, where 18 of them have PhD and 37 with master's degree. Next, please. Our work is guided by our theory of change, which we aim to achieve by strengthening capacity in evidence-informed decision-making, generating, synthesizing, and translating demand-led research on 5 priority SDGs that inform our thematic programs, including gender as a cross-cutting theme. We also conduct advocacy for evidence uptake into policies and programs. And lastly, we elevate African voices on the national and global stage. Next slide, please. AFIDEP MERL leadership is seen in many ways through our projects. Overall, we currently lead about 30 projects by diverse funders, including bilateral agencies like USAID, which, among others, is funding the BUILD project, where we are the first African NGO with this distinction. We also get support from foundations and African governments. These are capacity strengthening, policy, advocacy, and research projects, which also have MERL components. Some examples of our MERL-specific projects include an evaluation of the Global Challenges Research Fund, GCRF, and the Family Planning Sexual Reproductive Health Impact funded by GATMARCA. We also read the evaluation of the Gavi Girl Effect Partnership to expand the HPV vaccine. Next slide, please. In terms of our internal capacity building, AFIDEP strategy outlines the structure of the MERL, including the MERL unit and other systems that are required to operate effectively. There is also Village Foundation, which provides co-funding and organizational development grant. And this is the funds that were used to develop the strategy 2020 to 2024, and also to carry out an assessment of the MERL within the institute. And it also supported the staff retreat which reflected on the performance of the strategy 2020 to 2024. We also have CIF Organizational Development Grant for which was used for MERL strengthening, for MERL system strengthening, performance review. That's the performance for 2020 to 2023, and the strategy development. This is the development of our new strategy 2025 to 2029. Next slide, please. So before we move to the next slide, also in terms of the visibility strategies, we have the institutional cons, and then resource mobilization and donor engagement, and there also results framework. At project level, we also have our strategies for visibility and communications. That guide our communications. The strategies that guide when we're communicating the outside world. Next slide, please. So based on AFIDEP's experience, we have found that some of our facilitators to lead MERL work include staff MERL expertise, organizational M&E systems that include automation of key MERL functions, high visibility where we work, and increasing recognition of our work on the global level. For example, we were given the United Nations Population Award in 2023. We also have supportive leadership from top management for growth. And some of the challenges we've faced include political leadership, which impacts the continuity and demand for MERL work by governments, overall investment in MERL, and difficulties for us to secure leadership roles in key MERL projects post funders. Next slide, please. Now I'll hand it over to Karen to discuss about New Era. Over to you, Karen.
Thank you, Laona. So I will begin my presentation by discussing New Era's experience in MERL leadership. So New Era is a non-profit distributing national level research organization registered in Kathmandu, Nepal since 1971. We have demonstrated management expertise in MERL, including established system in place to handle diverse contracts and projects of comparable scope, size, and complexity. Specifically, we have conducted over 900 surveys, including impact studies to participatory and action research. Moreover, every year we support the technical growth of master students in Nepal through Dr. Harkogurung New Era Fellowship Program that was initiated in 2005 and have trained nearly 200 students from Nepal's different universities on research methodology, data analysis, and report writing. Lastly, we are a women-led organization with multidisciplinary MERL staff that focus on health as well as other development sectors. Next slide, please. There is a selection of New Era's experience in MERL leadership focused on health sector. First, we have led nationally representative complex surveys focused on health and nutrition, including Nepal Demographic and Health Survey, Nepal Health Facilities Survey, also known as Service Provision Assessment or SPA, and Nepal Micronutrient Status Survey. We have conducted 6 rounds of Nepal DHS and 2 rounds of Nepal Health Facilities Survey and Nepal Micronutrient Status Survey. Additionally, we have also conducted baseline, midline, inline, and other impact surveys both on small scale as well as with nationally represented samples. We have also led destination meetings data use workshops from national to subnational levels with government, local development partners to inform programs and policies. Our staff have broad expertise in technology and skills to lead more activities, including computer-assisted personal interviews, analysis of quantitative and qualitative data, along with data visualization using analytical software. Next slide, please. Now I will discuss NUERA's approach to capacity strengthening. NUERA is widely recognized for our expertise in participatory learning action approaches through our participatory rural appraisal training. We have provided capacity strengthening of over 40 government, NGOs, and CSOs since 1989. We also led multidisciplinary training programs, including to diverse agencies involved in broad development activities in Nepal. Our training approach supplements theory with practical exercise to prepare for future implementation. We also support public sector capacity strengthening in data analysis. For example, we have supported skill development to conduct analysis using health and information system and secondary data sources, and have trained local faculty in complex survey methods. Our organization is very focused on providing youth employment and applied training opportunities. The fellowship program is a key component for this focus. Lastly, we support our staff to participate in new learning and growth opportunities in all skills. Next slide, please. Regarding facilitators and challenges, for NUERA's perspective, there are some facilitators and challenges experienced to lead more work in Nepal. Facilitators have included extensive experience with multidisciplinary staff and high retention rates. Demonstrated our resilience and adaptability with success. Our fellowship program to train new MERL professionals, building our staff as well as the local environment. We have strong technical skills in key MERL activities. And some of the challenges we have focused that include reliance on donor funding and low funding for MERL opportunities for activities we can pursue. Thank you so much. Over to you, Molly.
Thank you, Karen. Okay, now we'll begin our panel discussion. So the structure for this section, moderator questions that will show on the slides. Each panelist, our 3 panelists, will have about 2 to 3 minutes to respond to each question. And we'll have a total of 6 minutes per question with 4 questions total. And then our panelists are invited to ask follow-up questions of other panelists or provide further commentary. And then as time allows, we will answer audience questions. And the order that we will conduct the panel will follow the order of this presentation. We'll start with AFIDEP, and then we'll move to New Era, and then we'll have a representative from USAID respond. So our first question is, what does locally led MERL mean for you and your organization? So why don't we start with Luana to give some perspectives from AFIDEP.
Thank you, Maury, for the question. So locally led MERL for AFIDEP means that AFIDEP is entrusted to lead the work, set the agenda, and assess the local needs, plan and implement the MERL work. The locals and their systems and institutions as the prime beneficiaries are at the forefront of decision-making in research and evaluation. It is driven by the needs, challenges, and social political context of the local people, which the local actors understand better. It is about learning from peer organizations, institutions, and countries. It requires external support, of course, which could be directed to the long-term individual and institutional capacity strengthening efforts, for example, technical assistance and systems development. Thank you.
Thank you, Luana. Karen, how about you?
Thank you for your question. Actually, the question is very relevant in current scenario where Nepal is in early stages of federalization. So local organization should given opportunities with minimal support at provincial and local levels. Further, this local led MERL means partnering with local institutions for joint MERL initiatives, developing and utilizing local expertise for data collection and analysis, creating feedback mechanisms that involve local communities in interpreting and acting on MERL findings, investing in long-term relationship with local stakeholders to ensure continuous learning and improvement. Overall, local-led MERL is about shifting the power dynamics to ensure that local actors are not just participants, but leaders in MERL processes, leading to more effective, sustainable, and equitable outcomes. Organizations like NEWRA with extensive experience in MERL should be given the chance to support local organizations at the provincial and local levels, especially when these organizations secure funding through competitive process from donor agencies. Further, local-led MERL also helps to adopt a uniform, systematic MERL activities to advance broader organizational learning and development efforts. And the organization at the local level are nimble, adapted quickly mobilizing staff with expertise needed for MERL, and able to provide presence in remote, to reach marginalized and underserved communities across Nepal. Thank you so much.
Thank you so much for that response. And now, Christina?
Yeah, thank you, Molly. So, I'm just going to echo, I'm not going to repeat, I guess, what Barbara said earlier in the slides, because I think she did a great job kind of laying down the nuts and bolts of the locally led development policy for USAID. But I do want to say something that, if anyone's heard me talk about this, you've probably heard me say this before, but we really want to make sure that we're not just changing our way of working to meet the two targets that the administrator has laid out. We have the target of 25% direct local funding, or direct funding to local partners, and then 50% locally led development, which is a huge kind of composite, complicated indicator. But that's not it, right? We want to make sure that we are really pushing for changes in the way that we are working at USAID and the way that we are working with our partners in order to really facilitate kind of a holistic mindset shift. And I've said many times in other forums that, we really want to make sure that what we're doing is constantly in the spirit of localization. It's not just meeting the targets, it's not just checking the boxes, but we're really making sure that everything we're doing is in the spirit and is moving our local partners and elevating our partners as much as we can and taking a step back in the background for us as USAID. And actually, my colleagues on the panel said this much better than I ever could have. They took these great points and they made them even better that I was going to bring up. But just echoing what Luana said, that it's really important that the metrics that we use reflect what the local stakeholders' understanding is what's important for them, what really matters. So we are measuring what matters. They are measuring what matters, not what matters to us, but what matters to them and to their own outcomes that they're seeking. And I also think it's really important that we really start to deconstruct and to really unpack what some of these various constructs mean that we so typically measure. It's something that we're doing in a couple of our programs. We're just starting to kind of scratch the surface, but to look at kind of terms and constructs that we typically use in our programming and to say, okay, that's what this means to us with a Western high-income country perspective. But what does this mean to the communities that we work with? What does this mean to the local partners that we work with? Agency is an example that we're doing in one of our projects to really look at globally across the world and across different cultures. What does agency mean? Does it matter? Why does it matter? And to then be able to look at that kind of across the global context and see how that can inform our programming going forward. And then the other thing I was going to bring up again was Kieran said it so much more eloquently than I could have, but just making sure that we are incorporating feedback mechanisms into our work, because it's really crucial to share back the data with the communities in which we're collecting it from. So, any opportunity to share data back to communities so they can have their own opportunity to act on it as well. It's not just extracting and taking from the people that we are working with, but it's really sharing it back so they can use it as a tool for themselves. And then also looking at opportunities for community-led monitoring and community-led kind of metric development. So I'll stop there. Thanks.
Thank you, everyone. I appreciate everyone's responses. I just want to remind our participants that if you have questions that you'd like us to answer, please put it in the Q&A and we'll try to get to it at the end. Oops, sorry. Okay, so we'll move on to our second question, which is how, if at all, have opportunities for locally led MERL shifted in recent years? And then the second part to that question is, what is driving or preventing a shift to locally led MERL? So again, we'll start with Luana.
Oh, thank you, Maury, for that. So the localization agenda has created opportunities. I mean, what have the opportunities for local leadership shifted in the recent years? That's what I'm trying to address. The localization agenda has created opportunities for locally led MERL. Now, in recent years at AFIDEP, we've seen an increased number of global North organizations seeking to partner with us in proposal development and even in actual implementation. There's also growing recognition by developing agencies, partners, and practitioners of the importance of locally led solutions in research and evaluation, grounded in the needs and priorities of the local people. COVID-19 is also one of the factors which affected the results and performance of MERL, but at the same time stimulated important innovations in the use of digital technologies in MERL. However, from the analysis we conducted during the review of our strategy 2020 to 2024, we found that few African-based organizations conduct high-quality policy-oriented evaluations and research. And there is an overall lack of monitoring, evaluation, and learning systems in both state and non-state institutions. These are some of the obstacles affecting the locally led MERL efforts. Thank you.
Thank you so much. Now, Kieran?
Thank you. Actually, in recent years, opportunities for locally led MERL have shifted due to various factors that either drive or prevent this transition. Some key trends and influences of there is growing acknowledgement of value of local knowledge and expertise in designing and implementing effective MERL processes, and donors and international organizations are more frequently prioritizing local partnerships. And there is also advancement in technologies, including mobile data collection tools, online platforms for data analysis, communication technologies, have made it easier for local organizations to conduct MERL activities independently. And there, the funding has also been shifted. Some donors are increasingly allocating funds directly to local organizations rather than through international intermediaries. So this shift is partly driven by desire to enhance sustainability and local ownership of projects. There has been a concerted efforts by international organizations and donors to build the capacity of local organizations. This includes training programs, technical support, and development of local MERL networks. In some countries like Nepal, decentralization and federalization have empowered local governments and organizations, providing them with more autonomy and resources to lead MERL activities. And the drivers of the shift to local lead MERL is seen more sustainable because it builds local capacity, ownership, ensuring that MERL continue beyond the lifespan of externally funded projects. Similarly, local organizations have deeper understanding of the cultural, social, economic context in which they operate. This leads to more relevant and effective MERL processes, and local organizations often operate at lower cost compared to international organizations, making MERL activities more cost-effective. And locally led MERL promotes accountability, transparency by involving local stakeholders in evaluation process, which can enhance trust and ensure that findings are acted upon. And further, the preventing shift or barriers to shift to local-led MERL are despite there is capacity building efforts, local organizations may face challenges in terms of skills, resources, infrastructure to effectively conduct MERL activities. There is also funding constraints. While there is a trend toward more direct funding to local organizations, many still struggle to secure consistent and adequate funding for MERL activities. Some international organizations and donors may be reluctant to cede control and may have concerns about the quality and reliability of MERL conducted by local entities. So in conclusion, the shift towards local-led MERL is driven by combinations of increasing recognition of local expertise, technological advancement, funding shifts, and policy changes. However, this shift is not without its challenges, including capacity limitations, funding constraints, and institutional resistance, as well as political hurdles. So addressing these barriers through targeted support and fostering an enabling environment can further enhance the effectiveness and sustainability of locally led MERL. Thank you so much.
Thanks.
Thank you so much. Go ahead,
Yeah,
Christina.
Karen, those were great points. I think everyone's probably aware, but it's not just USAID really that is kind of doing this push for localization, right? There's really kind of global momentum to transfer leadership to local organizations and to national level stakeholders and partners as well. Yet I think everyone is also aware that to do this, we really need to kind of fully dismantle a number of our mental models, our physical policies and processes, internal ways of working. All of these types of things are really necessary to be able to truly localize. So I think that these are opportunities because there is this global momentum, but it also is a real challenge because it's a true, kind of 180-degree shift from the way of working that we've been doing for the past number of decades. But I think that, we need to kind of take this momentum. We all need to kind of figure out what our part is in moving this forward. It's a little bit challenging, right? When, the kind of donor organizations who are the ones that need to change the most are kind of taking the leadership role in changing, and it's like you're in an echo chamber of your own thoughts, right? So we need to make sure that we're taking every opportunity to listen to our colleagues and peers and to kind of take a step back and to have them lead us and guide us in how we should be doing better to localize our efforts. But it is difficult when you're in a huge bureaucracy that's embedded in the US government. So I think we're all doing the best that we can. But I also wanted to point out, I think it's really interesting in the results of the scan that Molly shared earlier, that it showed that really few MERL organizations are local, or kind of leaders in the efforts are local or regional partners. And yet I think we can all understand that, at least anecdotally, most of the data collection efforts and the really kind of community level efforts are being done by local partners. So I think we really need to take a step back and look at that and say, where's the disconnect here, right? Like we are empowering and we are trusting our local partners to do all of this data collection, yet we're not trusting them to analyze the data that's coming from, their own peers or their own kind of communities. So why is that? What is this issue with trust and with, validity? And I think we as kind of donor organizations and we as, leading partners and organizations, we need to take a step back and really unpack some of those biases, right, about what we consider real or true or valid data. So I think that's something that is kind of preventing us from shifting, is this understanding of what we think of as good and what we need to kind of trust our peers and our local stakeholders to help and really lead analysis and leadership of agenda setting as well.
Thank you, Christina. I just want to touch on a point that you just made about the rapid scan that we did. We did find examples of MERL work that was led by local organizations. It's just that the literature didn't really describe this pathway to how they came towards in these leadership roles, because it's kind of not really a common topic that one would publish, for example, in the global health literature. It's not very common. But that being said, some of the examples I found that were examples, particularly of talking about capacity strengthening, and it was particularly talking about or whether it was an academic institution or researchers in country who were leading capacity strengthening for the health system in country. I think what was really interesting, first of all, these were actually impact. They were assessments of that MERL capacity strengthening effort, and they did the several examples I found did find positive results. But what I found was really interesting was the approaches that were taken, and it was a demonstration of why we need to be moving towards locally led MERL, because the approaches that they were taking were really building upon the existing system. And really, it was because of the understanding of the local context, understanding of the resources available, understanding of the environment that they work within, that their approach to capacity strengthening, I thought, was so interesting and novel in a way that we often don't see when you have organizations that are coming in from other settings to focus on capacity strengthening. So there definitely are examples. It's just we have limited documentation. But it's also one of the reasons why this discussion and this dialogue is so critical, because I think hearing directly from organizations about your experiences and perspectives is so critical, because from the published literature, it's just hard to find it. So anyways, I want to thank everyone that's putting responses in the Q&A, and just to please continue to put your questions in. We're trying to answer some of them as we're continuing, because there were some of the questions we were answered earlier. So some of our colleagues are responding in real time, and others we'll try to get to as we continue with our own panel. But please continue to put your questions into the Q&A section. Okay, moving on to question 3. Okay, so what needs to change now to increase opportunities for locally led MERL in the future? So again, we'll start with Luana.
Thank you, Maury, for that good question. So I think we need to start building trust among the local beneficiaries, governments, and external funders to increase demand for locally led MERL initiatives. There's this belief that everything that is not from your country is better. And now we need to trust that the work that is being done locally is also better, as good as any other work that could be done anywhere else. So that trust we need to build. Also, there's a need to increase investment in the local institutions, actors, and systems to strengthen their capacity to undertake MERL work and produce results that meet the conventional standards but are tailored to the local context. These institutions and systems need to be strengthened. They need to be funded so that they can be able to produce the work that we desire, the standard that we are all anticipating to be good. MERL should not be ad hoc, but rather systematic and embedded into the development programs from the onset to the closing of the programs and even beyond. So MERL is not something that comes when the project has already started, but it's something that we need to start as the projects are starting or programs are starting. This needs to be embedded inside the whole system. The funders' interest and goals should be aligned with the local interest. So here we're talking of balance of interest, not balance of power, because we know that maybe cannot be able to balance power between two entities, but we can be able to balance. But what we can always find a point of convergence for interest. So it's easier to balance interest, more difficult to balance power. That's what we're looking up to say funders' interests and goals should be aligned with the local interest so that there's a balance of interest in there. Yeah, so these are some of the things that we could do to increase chances for the locally led MERL in the future. Thank you.
Thank you, Ilona.
Thank you, Molly, for the question. So to increase opportunities for locally MERL in the future, there should be several key changes are necessary across various dimensions like capacity building and training. So we have to develop comprehensive training program focused on MERL skills, including data collection, analysis, reporting, and as well as the use of technology in MERL. And we also need to establish mentorship and peer support networks where experienced MERL professionals can provide guidance and support to local organizations. And also, we also need to advocate for and implement policies at national and sub-national levels that support the autonomy and capacity of local organizations to lead MERL activities. And we have to strengthen the decentralization process to empower local governments and organizations with authority and resources to conduct MERL independently. Further, we also need to foster a partnership between international organizations, donors, and local entities that are based on equality and mutual respect. And further, we have to develop platforms for collaborations and knowledge sharing among local organizations, so international partners and other stakeholders. We also need to improve access to technological tools, resources that facilitate efficient and effective MERL activities such as mobile data collection applications, data analysis software, and other online collaborations tools. We also need to establish innovation hubs or labs where local organizations can experiment with new MERL methodologies and technologies. And we also need to develop and promote these standardized MERL frameworks and guidelines. Further, we have to enhance the capacity of local organizations to analyze and interpret data effectively. And we also need to promote local leadership in MERL process to ensure activities are relevant and sensitive to local contexts and needs. So I think these are the things to increase opportunities for locally led MERL in the future. Thank you so much.
Yeah, so I'll jump in. Those were great insights. I was taking notes myself too, so we can make sure that we're learning from each other. I think that one thing that really needs to change is, and this is something that there's been a bit of momentum on recently, and I think it needs to continue, is that, typically when we think about capacity strengthening for partners, we're often thinking about kind of technical capacity. So when we're talking about MERL partners, we're talking about the ability to collect data, to analyze data, all these types of things. But we're less often talking about in our programming about organizational capacity strengthening. So how can we support organizations to really build up their administrative technical capacity, their financial capacity? So to be able to help them be more competitive, to be able to bid on projects, to be able to be stronger partners, to be able to really lead these efforts, not just in a technical capacity, but also that their organizations are strong enough to be able to kind of take these roles on from start to finish, not just do one piece of the MERL kind of pie. So I think that this is something that as a donor, we're starting to understand more that we need to make sure that we are allowing our funds and encouraging our funds to be used for that purpose as well. It's something that I still think we all need to push for, right? It needs to be pushed for at the USAID side. It needs to be pushed for at the partner side, to be able to say, hey, we need this in order to be a better partner and to do our jobs better. We need this capacity strengthening as well as this capacity strengthening. We've heard a lot in all of our conversations with local partners over the last few years that where this commitment to that type of capacity strengthening has happened, where it's in results frameworks, where it's really like a big part of the project, that the project itself and the partner is much stronger for it. So they feel like that really has a big transformative impact on their ability to do work, do it better, and be able to bid on new and future projects and be a stronger partner. So I think that that's really important, and it's a huge opportunity that we all need to be kind of leveraging and pushing for. I also think this idea that Kieran, you mentioned about technology and really making sure that we are encouraging our partners to use and leverage new innovations in technology. I think there's huge opportunities with AI right now for MERL. And so we need to make sure that that's just not happening at like the headquarters levels of organizations, right? That we're making sure that all of our colleagues and our stakeholders are able to kind of leverage those new technologies. And I was also thinking that, this idea of mentorship and peer support, I think is really important as well, Kieran. And so I think that we need to make sure that we are working as connectors to bring our projects together, to bring local partners together, to be able to kind of foster those peer support networks. Again, that's oftentimes considered like the softer side, like the less important side of the work, right? But we know that it's so important for sustainability, for like longer term outcomes that we're looking for. So I think we need to pay as much attention to those types of activities as we do to like the nitty gritty MERL work itself. Over.
Thank you. Thank you, everyone, for those responses. Okay, so our last question is for Luana and Kieran specifically. So what are the approaches that your organization has taken to both identify and then to pursue MERL leadership opportunities? So let's start with Luana.
Oh, thank you, Maurice. So we have done a number of things. Some of the things that we've done includes we have strengthened the capacity of the project teams, like the internal teams, and then also the external stakeholders on MERL in all our projects. So we have all the projects, we have a team that is helping in data collection and reporting analysis and also designing of the indicators and collecting data on those indicators. So we make sure that we're training them on how they can be able to do that and come up with results frameworks, log frames, and all those. And also we've supported governments in developing MERL systems for tracking progress and assessing the performance of the development programs in Malawi, Kenya, Botswana, and other countries. So, for example, with Botswana, we had this program called Botswana Demographic Gifted Program, where we designed the program, and then we had also embedded into it an M&E system, which they integrated into the MERL system to help them be able to track the changes that are happening from the gains that they're getting from the health and those population programs because of the interventions that we supported them to do. So that's one of the things that we've done. And we've also established partnership with leading institutions across the region and globally, including expanding our interventions to the Philippines, and the Nepal under the BUILD program as part of the South learning and the cooperation. So we really would like to bring in South to South peer learning there from different organizations where we learn from them, and also we help them to learn some things from us. So this partnership is really important for us as part of expanding our work on MERL. We've also communicated the difference we are making or influencing across the continent through webinars. So we have participated in a number of webinars, even organizing some of the webinars. One of the webinars we're participating related to evaluation is the G-Local Evaluation Week, which is happening today, I think, right now. So where one of our directors is there making a presentation on how to use data in reducing domestic health, increasing domestic health financing and reducing inefficiencies in the use of health budgets. And we also organize or participate in regional conferences. Two of the conferences that we've just organized is African Population Conference which we organized last week. This is a conference that brings together traditional experts across Africa and also beyond. Or we've also organized a NIAPACO. We supported the organization of the NIAPACO. NIAPACO is the Network of African Parliamentary Committees on Health. This is also a very big conference which brings together parliamentary health committees to discuss about health issues. So in this case, we're able to make sure that we're communicating the difference in terms of data collection, data use in decision making. We've also used the media, both the website. We have the website which has much of the work that we do, which showcases much of the work that we do. We use social media and even mainstream media, radio programs that talks about the work we do related to learning and knowledge management and monitoring and evaluation. Yeah, so those are some of the things that we've done so far. Some of the things that we've done, of the many things that we've been doing to enhance our MERL efforts over.
Thank you so much. Sorry, I switched the slide. Go ahead, Kieran.
Thank you, Molly, for the nice question. So, NEWER has implemented several strategy approaches to identify and pursue more leadership opportunities, ensuring that local stakeholders are empowered and our small processes are effective and contextually relevant. Some of the key approaches we have taken are worth mentioning, like building a local capacity. We have conducted training programs for organizations, including training on this DHS and health facility data at some of the institutions of Tiruvan universities. We have also conducted need assessment and planned workshop to update local research organizations on data analysis and latest MERL methodologies and tools of particular. And we have started this need assessment from Kosi province and plan to have the data analysis soon. And we have also identified the organization in all 7 provinces of Nepal and build partnership with local institutions, NGOs, and CBOs. Similarly, we are preparing strategies for creation of local MERL networks where organizations can share experience, best practices, and resources. And we are actually preparing 3 years of strategies where we have planned to engage in advocacy efforts to promote policies that support local leadership in MERL. And in next 3 years, what we are planned is to support decentralization efforts that give more control and responsibility to local governments and organizations. And further, we regularly monitor and evaluate the effectiveness of our capacity building support initiative to ensure they meet the needs of local organizations. And we have also feedback and evaluations mechanism. We adapt our strategies to better support local MERL leadership. And NEWER strives to enhance local leadership in MERL, ensuring that our programs are more effective, sustainable, and responsive to needs of the communities we serve. Thank you so much. Over to you.
Thank you so much. I'm going to actually reformulate that question and pose it to Christina to ask, from the perspective of a funder like USAID, what are some approaches that have been taken or will be taken to increase, for example, the opportunities for locally led MERL?
Yeah, thanks, Molly. I think the big one is a lot of the work that we're doing in the localization agenda, right? And a lot of that has to do with how we are trying to make our funding opportunities more accessible to local organizations and local partners. There's a lot of work being done on the back end. I know it seems like maybe tiny incremental changes, but there is a lot of work that's being done internally to try to kind of break down some of the barriers that have been expressed in multiple kind of listening fora. So I think we have the workwithusaid.gov website, which is available now, which provides a lot of intel and information for newer local partners or newer any partners really on how to find opportunities to work with USAID. And that doesn't even mean just direct funding opportunities, right? It means how to look for opportunities to work in consortia with other partners. A lot of this is also around co-creation, right? A big push in USAID is about making sure that we're doing more co-creation, not just at the activity level side, but in the kind of design and activity development side. So working directly with partners to kind of make sure that our programs are co-created with the communities and the partners and stakeholders that they serve. And so those are some opportunities. There's also a lot being done to work in local languages, to not just have English be the working language for funding opportunities and also for work. We're trying our best to make kind of our efforts and our processes more accessible to those who don't speak English and working in local languages. So there's a lot being done on translation and on making sure that we're trying to change some of the restrictions on things that do have to be in English. So that's some of the things that USAID is doing to kind of make MERL opportunities available and also make them more accessible for local partners. I'm going to stop there in the interest of time.
Thank you so much. I'd like to thank all three of our panelists. That was an incredibly rich discussion. And I really appreciate everyone's contributions and for sharing your experiences and expertise. This webinar will be recorded and will be available online. But before I lose many of you, we do have a post-webinar survey. You can get access to it with the QR code here. And this is just really to get a better understanding, as I mentioned, with this gap in the literature. It'd be really useful to hear about particularly those of you who work with or work for local MERL organizations, to describe some of your experiences. That'd be helpful for us to capture that to, again, better understand what's happening. And again, thank you everyone for your participation. Thank you to our panelists and our presenters for your time, and wishing everyone a good either start to your day or end to your day, or good afternoon, given that we have a global audience today. So thank you, everyone.